Imagine a painkiller. One so powerful it can completely numb you for major surgery. But it's also so risky it could literally stop your heart. So what if chemists could figure out a way to keep all that power but just get rid of the danger? Well, that's not science fiction. It's the real story of Ropivacaine.
And that question? It's really the heart of the matter for anesthesiologists. I mean, they need drugs that are strong enough to block some of the worst pain imaginable. But the very drugs that do that can be incredibly dangerous, especially to the heart. It's this constant high-stakes balancing act between giving relief and managing risk. So, to really get why ropivacaine was such a massive breakthrough, we first have to take a look at the drug that came before it, a super popular local anesthetic called bupivacaine. Now, it was fantastic at numbing pain for a really long time, but it had this hidden, dangerous flaw, one that was baked right into its chemical structure.
Okay, to understand this flaw, we've got to zoom way in, down to the molecules themselves. It all comes down to this concept called stereochemistry. Just think about your hands for a second. They're mirror images of each other, right? But you can't lay your left hand perfectly on top of your right. They just don't match up. Well, a lot of drug molecules are exactly the same. They exist as these left-handed and right-handed versions, and we call them enantiomers. And believe it or not, that tiny difference can change everything.
And this was exactly the problem with bupivacaine. See, it was sold as what's called a racemic mixture, basically a 50-50 cocktail of both its left-handed and right-handed forms. The left-handed molecule, the S enantiomer, that was the hero. It gave you all the great pain relief. But its right-handed twin, the R+ enantiomer, that was the villain. It also numbed pain, sure, but it was way more toxic to the heart, so every single dose was a gamble.
So, this got scientists thinking. They asked this brilliant question. What if we could just isolate the hero molecule and completely get rid of the villain? That really simple idea, well, it sparked the creation of bupivacaine's safer sibling, a drug that was literally designed from the ground up to engineer the danger out.
And here's the key. Ropivacaine is not a mix. It is the pure, isolated, left-handed molecule, the S enantiomer. That's it. By just removing that more toxic right-handed mirror image, they created a drug that kept all the powerful numbing effects, but dramatically reduced the risk of those life-threatening heart problems.
And you can just see the difference right here. It's so clear. Look at bupivacaine. A full 50% of it is that riskier cardiotoxic form. Now look over at ropivacaine. 0. It's such an elegant solution, right? They didn't have to invent a whole new drug. They just had to perfect it by taking out the dangerous part. So we know it's safer, but how does it actually work? How does ropivacaine literally switch off a pain signal? Well, the answer is in some pretty fascinating biology that's happening inside our nerves. Okay, so think of your nerves like little electrical wires. For a pain signal to shoot up to your brain, these tiny gates, called sodium channels, have to open up and let sodium ions rush into the nerve cell. What ropivacaine does is it gets inside that nerve and it physically plugs up those channels, just blocks them. So no sodium gets in, the electrical signal can't fire, and that pain message, it just stops dead in its tracks. Your brain never even gets it. But ropivacaine has another really cool trick up its sleeve. It turns out that not all of our nerve fibers are the same. The very thin fibers that carry pain signals are way more sensitive to the drug. They get blocked much more easily than the big, thick fibers that control your muscles. This clever targeting is called a differential blockade, and it is a huge, huge advantage. And this is where that cool targeting really becomes a superpower. Doctors can actually fine-tune the effect based on the dose. So at low concentrations, you get fantastic pain relief with almost no muscle weakness. But if you crank up the dose for, say, a major surgery, you can get a complete block of both pain and muscle movement. This versatility is what makes it so incredibly useful in so many different situations. Okay, so all this cool science is great, but what does it actually mean for patients in the real world? Well, it translates directly into better care. Let's take a look at where this drug makes a massive impact, from the operating room all the way to the recovery ward. Its uses are just incredibly broad. It's a cornerstone for epidurals during labor and C-sections. It's used for major nerve blocks that can make an entire arm or leg completely numb for surgery. And this is really important, it can be slowly infused through tiny catheters for days after an operation to give you continuous, targeted pain relief right where you need it. And a huge part of its appeal is how long it lasts.
A single shot can give you really profound pain relief for 2 to 6 hours, sometimes even longer. This long-acting nature is just perfect for getting patients through those first, most painful hours after surgery without needing constant injections. And this quote right here, it just nails why that differential blockade we talked about matters so much. For a new mom after a C-section or someone recovering from D-surgery, being able to control the pain while still being able to move, that's a total game changer. It means you can get up, get walking sooner, and that speeds up your whole recovery. Okay, but we have to be realistic here. Ropivacaine is a huge leap forward in safety, no question, but it's still a really potent medication. Safer does not mean zero risk, and if it's not used correctly, there can definitely still be serious problems. This can happen if too much of the drug accidentally gets into the bloodstream. And the early warning signs are kind of subtle. A weird metallic taste, maybe some ringing in the ears. But from there, it can quickly progress to muscle twitching and, in really severe cases, seizures and even loss of consciousness. This is exactly why careful technique and constant patient monitoring are so critical. But here's the amazing part. Even for this worst-case scenario, medicine has a brilliant antidote. It's called intravenous lipid emulsion, or lipid rescue. See, ropivacaine is fat-soluble. So when doctors inject this fatty liquid, it acts like a sponge, a lipid sink. It literally pulls the ropivacaine molecules out of the sensitive tissues in the heart and brain, trapping them in the blood where they can't do any more harm. It's an incredible and effective emergency fix. And that really brings us to a final, pretty powerful idea. The story of ropivacaine is just a perfect example of smart, targeted drug design. It proves that sometimes the biggest breakthroughs aren't about discovering something totally new, but about meticulously, cleverly improving what we already have. It really makes you wonder, doesn't it? What other common drugs out there might be hiding a riskier mirror image, just waiting for their own life-saving redesign?